As we always do, we start off with the COVID-19 situation here in Korea. South Korea has seen its total number of COVID-19 infections surpass the 10 million mark.
In other words, 1 out of 5 South Koreans have at some point been infected. For more, we turn to our Shin Ye-eun, who's joining us live in the studio. Good morning, Ye-eun.
Good morning.
So we heard that the total number of cases in South Korea surpassed the 10 million mark yesterday. So how many cases are we expecting for today?
Well, Mo-gyun, we're expecting to see the daily tally go back up in the 500,000 range. As of 9 p.m. on Tuesday, we saw 475,276 new infections, which was the second highest tally ever recorded for this time period. So we're expecting to see the second highest daily figure on Wednesday. A week ago, we actually saw the highest tally going up as high as 621,000. Though today's figures aren't expected to be as high, they have definitely climbed up by something like 140,000 from a day ago. Usually Wednesday's figures act as a key barometer for the weekly trend compared to when the numbers are lower at the beginning of the week due to fewer tests done over the weekend. As you mentioned, as of Tuesday evening, South Korea has seen its total COVID-19 count surpass the 10 million mark. The exact figure stands at 10,411,816. In just a month and a half, the country added 9 million new COVID-19 infections due to the spread of both Omicron and its subvariant BA2, also known as stealth Omicron.
I mean, again, 10 million does sound like a big number, but when you put it into a different perspective and say 1 out of 5 South Koreans, it's just a completely different view on this. Unfortunately, myself being at one point one of those 1 out of 5. But what we're finding out is that many of the South Koreans who've caught COVID-19, they're actually testing positive once again. So does that mean they've contracted the virus again?
I think this is a question many want to hear the answer to, and the answer is no. You will not be considered to have been reinfected even if you test positive in the first 45 days after you originally contracted the virus. In a briefing on Tuesday, health authorities said in order for one to be considered reinfected, 90 days must have passed. Citing data collected domestically and from abroad, authorities classified those who test positive in the first 45 days to have simply redetected the COVID-19 that they already had because reinfection rates are very low up to this period. It's only those who report symptoms or those who have traveled abroad and have tested positive with the PCR test overseas after 45 days who can be considered reinfected before the 90 days have passed.
Well, yeah, another question many are asking is that when will we be able to see the number of infections drop? So what do experts say?
That's right. So during Tuesday's briefing, health officials Shin Ye-eun said that it's difficult to determine at this point because authorities have just eased social distancing measures on Monday and because stealth Omicron is spreading like wildfire. Take a listen to what he said.
The proportion of stealth Omicron cases is rising in Korea, and when considering the fact that this subvariant is somewhat more transmissible than the original Omicron strain, we will have to wait and observe to make an accurate assessment on how the current outbreak may trend downwards after reaching its peak.
At the same time, Shin Ye-eun pointed out while we're seeing 30 times more COVID-19 infections than last December when Delta was leading another wave of the pandemic, the number of critically ill patients has remained quite similar.
Compared to the jump in new infections, we aren't seeing the number of critically ill patients go up that quickly because of the high booster shot rates, the low fatality of Omicron, and the administration of oral COVID-19 pills to those at high risk.
While the number of critically ill patients from COVID-19 has stayed in the 1,000 range, 3/4 of those have underlying conditions. Even though authorities said they would expand their medical capacity so that they could take care of 2,000 critically ill patients by late March, they urged for more efforts to be made on the booster shot front, especially for those at high risk.
That's right. I think a lot of people are still saying, why get the booster shot if you're going to get infected? But of course, I think there is still the very importance of getting vaccinated nonetheless. Yeon, as always, thank you very much for your thorough reports, and we'll see you again Thursday.
Thank you.